much of that just is like, especially for people in pain. I had a story this week, you know, so while there's some providers that may have thought I caused that dissection, just this week, yesterday, I saw an MD in town. He calls me frantic in the morning. He's like, I don't know, he's never been to a chiropractor. He's like, he's referred to me over the years, even though he's never been treated. He's like, I gotta get my back popped, that's what he says. I'm like, well, come on, you know, come on in, I'll check and see if you need an adjustment. And then I proceed to check him out, make a couple of adjustments on him. He's already had a spinal cord injury before, so he walks really antalgic. And when I make the adjustments, then he gets up, he's like, that really is better. You know, and he does one of these, and he's like, were you using your elbows? Oh. He's like, no, I didn't. You know, so just the point, he just doesn't understand anything about what we do. And he's like, what were you contacting my spine with? I'm like, positive and this and that. He's like, okay, cool, see you Monday. You know, so that stuff happens all the time. But again, what we're going to do, contact-wise, again, you guys know the terminology a lot better. I'm usually sitting here, and then I'm right-handed, so I tend to go to this hand. Now, of course, you get where you can adjust bilaterally, or you should. I still don't like adjusting on the opposite side of the table, so you're going to have that typical side of your table that you're going to work off of. But so if I were to come up, and I'll start with an atlas, but again, you got to make sure what you're doing if you're going to spin this atlas. I'm sure Tim didn't do that last week. Is anybody here for that? So you'll contact, and the misnomer here, in my opinion, is that you have to do rotation on this, that the only way you can contact is on a transverse process. But you really can get your finger in on the lamina, and if you have the right setup, you can still do more of a P to A, if you will. It's not going to look P to A, but you're getting a P to A movement. And that's one thing you need to consider as well, is, you know, think from the end. You've heard that in a lot of things in life, but when you're going to adjust, you know, think about what you're going to accomplish first. Because if you're just going in there to move something around, well, then that's where the difference becomes manipulation versus an adjustment, in my opinion. And you may move it around, and the body is so great innately that it may still get a good response and heal. But you do want to come in there with certainty of what your outcome is. And when I say outcome, I'm talking about where do you want that vertebrae to be. So keep that in mind, because sometimes that mental focus is going to make all the difference on really where this goes, in my opinion. It's kind of like training in the gym. You know, you can throw around a bunch of weight, but if you're not really thinking about the muscle you're working, you're probably getting about half as much benefit as if you're really focused on what you're trying to work out. So with Drake, and he's sustained a few traumas to his neck, that's for sure. But if I were to come in and say Alice, I'm coming in just below the occiput, and I'll move so you guys can see in a second. And I'm contacting, and for me, I got pretty good sized hands, so I'm just coming in here and literally using the end of my finger as a hook. Now, that's of course a TVP, but I'm kind of locking in on that TVP, and then I'm going to use the head tilt and that little bit of lateral flexion to open up the joint enough that then I can essentially slip it. And now, I'm not going to do a lot of this. I'm coming this way, but again, so based on this, you're looking at a line of drive like rotation, but I'm really still coming on a P to A. I've just got to get the head in that position. You got to have it tractioned out right, or you're never going to get the movement. It's going to be there'll be too many segments involved. You got to isolate it better. Now, I tend to kind of cup the ear a little bit. You know, watch with ladies, earrings and stuff. I don't have them remove them. I'm just aware of them, so I don't rip somebody's ear. But and if they want to take them out, they do. But otherwise, you can stay away pretty easy. You're going to come over, and I'm going to laterally flex. And here's the hard part for me right now is deconstructing this for you guys. And then I'm going to pull. So my motion here, you realize, it's exactly the same. So any of the technique classes, especially upper tries I've had, and as you go through palpation, the line of drive is not any different. If I had Drake laying here, like, go ahead and lay down for me if you would. So I was set up on the right side, for example, there. Now, if I was going to come on this on a supine adjustment, and I'm going to bring him over, where I am, I'm here in my line of drive. I've got his head in that position. That's the same position that I have him in when he's seated. There you go. So again, when you're thinking about this, just remember the anatomy didn't change. Okay, he's weight bearing, and that's a slight change, but not a lot. So then I'm going to laterally flex that and take that rotation out, and then I'm coming down. So that That line of drive is gonna change depending on whether you're at the Atlas, whether you're all the way down at C5 or 6. To get on the lower cervicals here, again, is a challenge because of people's traps, and there's just a whole lot going on there. It's not impossible, it's not real easy. Same difference as if you were behind making a adjustment, you know, P to A from the back, if you guys get trained on any of that. On the other side, I'll just step over here so you guys can see this. Again, same thing. Now, I'm using my chiropractic index finger to hook. You could do it, it doesn't really matter. Obviously, that's the longer finger. It definitely is for me, so it's a little bit easier. If your finger got tired, you can brace it, but usually when you're making these adjustments, so I'm gonna bring him here, and then again, I'm coming down this way. And it's all about speed, you know, the true definition of the high velocity, low amplitude. You know, I'm not going here. If I do that, it's becoming a lot more rotational, obviously, because something's got to give. But again, it's all the speed in that adjustment. So I don't know, maybe I should let a partner work on it. I don't know, maybe Travis already got you taken care of yesterday. But I can, you know, I can make that adjustment. Would you guys want me to go ahead and?
Yes.
Okay. Okay. Yeah. Again, I know his. Now, in his case, I'm on C2. So again, you can feel, and when you're palpating, you know, just find the fixation like you would, and it's going to be a little bit different seated like this, you know, just because of the muscle pull than maybe supine. That's totally a judgment call. So this is, in my opinion, not one adjustment's better than another. I do this just because it's what I've gotten used to and a speed thing initially, but I think it's good to have the different opportunities. So now, I don't know what that looks like in slow-mo.